Every 6 minutes, someone is diagnosed with Parkinson's disease. Parkinson's is usually identified only after visible motor symptoms appear, like tremors, stiffness, or difficulty of writing. By then, significant neurological damage has already occurred. Our healthcare system is reactive. We wait for symptoms before we act. This delay reduces quality of life and creates emotional and financial strain for families. Access to neurologists is also limited. Rural populations travel long distance, and many delay checkups due to cost or inconvenience. As a result, early risk awareness remains inaccessible for many individuals. To address this gap, we present Nervia. Nervia is a non-invasive Parkinson's risk detection platform powered by AI-driven vocal analysis. Research shows that Parkinson's affects speech patterns, including subtle tremors, pitch variation, and reduced voice stability, often before motor symptoms appear. With Nervia, users record a sustained vowel sound for a few seconds. The system then extracts 21 acoustic features which measure vocal fold stability and harmonic to noise ratio which evaluates voice clarity. These markers are processed through our machine learning module trained on clinical datasets to detect Parkinsonian patterns with high precision. After analysis, users receive a clear feedback. If elevated risk is detected, the platform recommends consulting a professional. If not, users can continue monitoring their voice over time through a personalized dashboard that tracks change. Because neurodegeneration progresses gradually, longitudinal tracking allows early deviation to be detected before symptoms become severe. Detection is only the first step. Through our preventive care hub, users can access guided vocal exercise or connect with verified neurologists for further evaluation. To understand Nervia's strategic position, we analyzed the neurology industry's value curve. The traditional system competes on advanced imaging, specialist expertise, and complex clinical intervention. It's expensive, anxiety-inducing, and accessible primarily after symptoms appear. Early monitoring, convenience, and testing frequency remain low. Nervia reconstructs this value curve. We reduce cost, required expertise, stress, and waiting time by shifting initial screening to AI-based voice analysis. We raise convenience, early detection, testing frequency, and personalization. And we create new value through preclinical intervention and continuous home-based monitoring. Instead of competing in late-stage treatment, Nervia expands the market by targeting the 3 tiers of non-customers. First, individuals with subtle symptoms or family history who delay clinical visits. Second, rural populations with limited access to specialists and those who can't afford repeated visits. Third, insurers and health platforms seeking scalable preventive monitoring solutions. By moving diagnosis from hospital-centered systems to accessible home screening, Nervia creates a new preventive monitoring space between healthy individuals and diagnosed patients. Using the Eliminate, Reduce, Raise and Create framework, we eliminate dependence on imaging for early awareness and need for in-person checkups. We reduce cost and time delays between symptoms and awareness. We raise monitoring frequency and personalization through baseline tracking. And we create real-time risk alert system and preventive self-monitoring ecosystem connecting users with specialists. Through our bio-utility map, we identified major pain points: high financial barriers, long waiting periods, geographic concentration of specialists, and lack of early-stage risk reduction. Nervia removes travel, reduces cost, and replaces medical complexity with clear, proactive insights. As a software-based platform requiring only smartphone microphone, it's scalable and accessible, especially in underserved regions. Our roadmap includes model validation, healthcare integration as a screening tool, and partnership with insurers focused on preventive care. Today, Parkinson's detection often begins after visible damage. Nervia begins earlier. The future of Parkinson's care should not start at hospital. It should start at home.